WHUR News here. We are talking about COVID-19 tonight and diabetes on HUR at home. You know, every week we have newsmakers that will share some interesting and thoughtful points from their individual perspectives. And tonight we have with us Tracey Brown. Tracey Brown is the CEO of the American Diabetes Association. And tonight she's going to share with us her thoughts about staying safe during the COVID-19 pandemic, particularly if you are a diabetic type 1 or type 2. Tracey, thanks for joining the conversation. How are you?
Hey, Harold. Thank you for having me.
Great, great. So even before I get into this really serious subject, we always ask, how are you doing? You're a diabetic. You are at home, working from home, trying to stay safe from, the COVID-19 bug that is particularly deadly. It can be for people with those comorbid situations. So how are you doing? How are you doing? How's your family doing?
Yes, Harold, first, thank you for asking. As a person living with diabetes now for 16 years, I have been doing everything I can to thrive while living with this disease. And of course, COVID-19 has just impacted me and my family just as it has impacted the country. I am following all of the precautions and things that I need to do. The number one thing for people living with diabetes is to make sure that you're actually managing your glucose, managing your blood sugars. Two, following all of the precautions. So from the sheltering at home, social distancing, wearing a mask, doing everything that you need to do to protect yourself as well as others. And from a family perspective, I have a wonderful husband. We've been married for 34 years. We have a beautiful 16-year-old daughter. Thank you. I am usually on the road. So this has been an interesting time to be sheltered at home with the family. And I think just puts into perspective, Harold, that you cannot forget what is most important, and just finding that time in our harried, busy lives pre-COVID. What I've learned right now is there's something beautiful about just slowing down, which this pandemic has caused, to connect with family in real and meaningful ways, and just being more present for my family. I thought I was, but it's been a wonderful thing.
Yeah, because I would imagine, at some point you could be sitting on the sofa with your husband, and then you see this 16-year-old person walk by, and you go, "Who is that?" Oh, that's our child.
That's exactly right. That's exactly right.
So there is, then you may turn to him and, "What's your name again?"
Exactly right.
There's something to be said for being at home, even under these difficult circumstances. And we've had a couple of people on my show talk specifically about that, is that this is forcing people to stay still. But one of the things from the perspective of those comorbid issues, hypertension, obesity, and of course diabetes, just because it is forcing people to stay still, it doesn't necessarily mean that they are staying safe. Talk to me a little bit about why, comorbidity, specifically diabetes, is dangerous while we have this pandemic in our midst.
Yes. So, Harold, what I want to clarify, there's a lot of information out there, some factual, some non-factual, as it relates to the science, as it relates to the correlation between COVID-19 and diabetes. There is some science out there. There's more that needs to be done. But one of the things that people are confusing a little bit. People are saying, hey, if you have a underlying condition, you're more at risk to contract COVID-19. That is actually not true. You're not more at risk if you have an underlying condition like diabetes, hypertension, obesity, heart disease. But if you do contract COVID-19, you are at higher risks for having worse outcomes. And why is that? Because usually when you have this underlying condition and your chronic disease is unmanaged, your immune system is already potentially weakened and working overtime. So if you do get ill, any illness, like even during normal flu season, you hear people say, if you're living with diabetes, make sure you get your flu shot. That's because when your body is fighting infection or sickness, your blood sugar levels get all out of whack. And so if that happens when you get COVID-19, what they're learning is if your illness is unmanaged, there is a higher probability for you to have worse outcomes, including death. In fact, Harold, there's about 90% of the hospitalized cases of COVID-19 are people with underlying conditions.
Mm-hmm.
So,
and that also speaks to why in the early weeks and months of the pandemic, we also saw our senior citizens, dying, to be frank about it, because they've lived a long time, and certainly their ability to fight off illness is considerably weakened as they get older. And as a matter of fact, just looking at some of the statistics just today, for those who had succumbed to the disease in the District of Columbia, there were 8 people who died today. The youngest person, I believe, was 56 years old. And after that, everyone else was 60, 70, and in their 80s. And certainly we don't know whether or not they had any of the underlying conditions, but certainly age makes people, more susceptible to this. And speaking to, the other issues as it relates to diabetes, about just trying to be healthier even during this time. Talk to me about what diabetics need to try to focus on if you have access to nutritional sustenance, and that you don't perhaps live in a food desert, for example.
Yeah. So, Harold, what I'm going to say is this is an issue and was an issue before COVID-19. And so I want to impress upon all people living with diabetes that we actually have more control than one might think. And 95% of people in this country, the 34 million people living with diabetes, 95% of those people are living with type 2 diabetes. 5% are living with type 1 diabetes. A lot could be said around the management of this chronic disease by what you eat, your exercise, your sleep, and your stress. Eating is one of those things that I want to impress upon people to take control. Watch what you're ingesting. Diabetes in and of itself basically suggests that your body has a hard time dealing with excess sugar in your body. Carbohydrates turns into sugar. So if you're watching what you're putting in your mouth, eating more green vegetables, less starchy foods, more proteins, meats, nuts, those kinds of things, just put yourself in a better position to start to manage the overall blood sugar in your body. Add on top of that, Harold, in addition to your food, your exercise. Moving your body impacts your blood sugars quite a bit. So I tell people, start where you are. Like anybody, and this is part of the problem with diabetes. People say you got to turn over everything that you have been doing. And when people are faced with that, usually they will not adhere for a long time. That's why I don't subscribe to diets, right? You just need to eat better, starting little by little. For instance, if you are eating, I don't know, let's just say that you eat potato chips, high in carbohydrates. Maybe you substitute, don't eat potato chips. Maybe you substitute that with something lower in carbohydrates. Maybe you can eat some nuts. Maybe you can eat some vegetables. Just start little by little.
Has the pandemic impacted how you manage your diabetes, or has your health practices remained the same pre-COVID into the pandemic?
So, I have been, I made a commitment a long time ago, Harold, that I was not going to succumb to diabetes and its complications, and I wasn't going to die from this disease. So I actually have really changed my lifestyle and have been thriving with diabetes. And changing my lifestyle means really paying attention to what I'm eating. I do exercise. I'm not one of these people who go to the gym every single day. Exercise because
nobody's going to the gym right now.
That's exactly true. Walking. Pre-COVID, I was taking the stairs. I would, walk in the neighborhood. Post-COVID, what's been better for me, actually, Harold, is we're cooking more as a family. I traveled 3 or 4 days a week pre-COVID. And so I was always in the predicament of eating on the run, eating in airports. And so having to be very particular about fast foods and what I could get on the run. Actually being home, we have been cooking and I can eat my favorite meals. For instance, this evening, we're having steak with Brussels sprouts. That's a perfect thing. Will not hurt my blood sugars whatsoever. Yeah. And then just exercising. I am not out as much because, again, I am taking precautions. So I'm doing more exercising inside, meaning my daughter's a dancer. We dance quite a bit. Now doing things like sit-ups and push-ups, which I probably wasn't doing all of that before, Harold, but there are things that you can do right here. And every little bit makes a difference as it relates to controlling your blood sugars.
I only have about a minute or so left, but share with me a website for the American Diabetes Association and what kinds of information we might find on the website to help diabetics or those who love the diabetics and care for them to get through this pandemic.
Yeah, so first of all, go to diabetes.org. At diabetes.org, we have a whole COVID-19 resource center that will tell you everything that you need to know about COVID-19, the research that is out there, things that you can do to continue to protect yourself, resources of places you can go. Harold, in this pandemic, anxiety is at a all-time high for many people. That is very real. There are resources there to help connect you with people. 2, you will find insulin. If you are on insulin and struggling to pay for your medication, given the fact that there are, 33 million people now unemployed, resources to get your medication. 3rd, you'll find things on what to eat during this time. So those are a few of the things that you can get. And I want just people to know you're not alone. Go to that site or call us at 1-800-DIABETES. No one should be feeling alone who's living with diabetes through this pandemic.
Tracey Brown, CEO of the American Diabetes Association, thank you so much for spending some time with us on HUR at home. You are at home. Your husband's home. Your daughter's home.
Everybody.
Stay home. Have the steak. Have the Brussels sprouts. Put a little balsamic on there, and just a little honey. That's just my tip for you. Tracey, thank you so much. Look, you stay safe. I really appreciate your time.
All right. Thank you, Harold. God bless.
Absolutely. Same to you. And of course, I'm Harold Fisher with WHUR News with HUR at Home. I will see you next Tuesday. Don't forget, you can see this on WHUR.com. Of course, also on our Facebook page and on YouTube. Stay safe during this COVID-19 pandemic. And as always, I will see you on the radio.